အားလုံးပဲမင်္ဂလာပါအဒီကမှာ knowledge channel ကနေပြီးပြန်လည်ကြည့်ဆိုလိုက်ပါတယ်ဒီနေ့မှာတော့စီမီရင်စီးပညာအကြောင်းတင်ဆက်ပေးသွားမှာဖြစ်ပါတယ်
Hey, we got a gunshot. GSW chest. Where? RTO's down. GSW chest.
Left.
What's the injuries?
ဒါကတော့တရင်စင်စီးဥတာရေးဌာနကိုပုံတူဖန်တီးထားခြင်းဖြစ်ပါတယ်တိုက်ပွဲမှာထမ်းရရှိခဲ့တဲ့ရဲဘော်တွေကိုစီးဥတာမှုခံယူဖို့ပထမဆုံးလွှဲပြောင်းပေးရမယ့်နေရာလေးဖြစ်ပါတယ်ဒီမှာတွေ့ရတဲ့ထမ်းရတဲ့အားလုံးကစံသက်တရုပ်ပြချက်တွေဖြစ်ရုပ်ဒေတာမျိုးတင်နန်းသားတွေပုံမှာပုံတူပြုလုပ်ထားတာဖြစ်ပါတယ်ကျင်ငန်းတွေကနေအဓိကပုံတူဖန်တီးပေးထားတဲ့ချက်ကတော့စီမီပြင်ကတိုက်ပွဲဝင်စီးတပ်သားတယောက်ကြုံတွေ့ရမယ့်ဖိအားပဲဖြစ်ပါတယ်
You're working all day, every day. It's hot outside. It's just kind of relentless after a while. You just gotta keep motivated.
The most difficult part for everybody would be the sleep deprivation.
ဒီလိုစိတ်ဝိစီမှုတွေကြုံတွေ့ရတာစိတ်သက်သာတွေအတွက်စင်ကုန်မှုကြီးတစ်ခုဖြစ်ပါတယ်။ချိကန်စစ်ပညာနဲ့15ပတ်ကြာစီးပွားဆိုင်ရာတင်တဲ့တယောက်ပြီးတဲ့နောက်မှာဆိုရင်တော့တင်နန်းသားတွေကဒီနေရာကိုရောက်ရှိလာကြပါတယ်။ဒါကတော့ရှေ့ကြာပြုလုပ်ရတဲ့နောက်ဆုံးစစ်ဆေးမှုဖြစ်ပြီးကွင်းစင်းလေးချင်းမှုလေးချင်းကလို့ခေါ်ပါတယ်။အဲ့ဒီနေရာမှာသူတို့လေးကတင်ယူခဲ့တဲ့များအရာအလုံးကိုအသုံးပြုဖို့အဆင်သင့်ဖြစ်နေရမှာဖြစ်ပါတယ်။
Course is so intense is because we're trying to prepare them for the rigors of battle. Without that little bit of stress every day, they're not going to be prepared for actual combat.
The culminating field training exercise consists of 3 parts.
Hey, talk to us.
Dismounted patrol.
We need to maintain pressure on this auxiliary wound. Let's
a battalion aid station.
Once he gets blood, I'm sure respiratory rate will drop.
And prolonged casualty care. Because combat medics are trained like any other Army soldier, during dismounted patrol, students are tasked with a tactical mission where they'll eventually come upon wounded soldiers.
Push up! You need to push forward! On your feet, push up! On your feet, push up! Push up!
And react accordingly to any threats that arise.
During large-scale combat operations, they're going to have to know how to move thoroughly and how to maneuver properly in order to save lives.
Nugent! What?
Come here.
Hey, secure this team!
တင်နန်းသားအနေနဲ့လူနာတယောက်ကိုစတင်တွေ့ရှိတဲ့အခါမှာပထမဆုံးလှုပ်ဆောင်မယ့်အရာကတော့ဘယ်လိုအဆင့်ရှိရဲ့စောင့်ရှောက်မှုမျိုးပေးမလဲဆိုဆုံးဖြတ်ဖို့ပဲဖြစ်ပါတယ်။ဒါတင်နန်းရဲ့ဒုတိယဆင်မှာဆန်းစစ်ဖို့လေ့လာခဲ့ကြရတဲ့အရာဖြစ်ပြီးအဲ့ဒီဆင်ကတိုက်ပွဲဝင်လူနာစောင့်ရှောက်ရေးပေါ်အဓိကအာရုံစိုက်ထားတာပါ။
You're gonna open up their gear, open up their top all the way down to the brown t-shirt. We start teaching it this early in the course because there's so much that goes into it. They need a lot of time to practice.
ထိချုံမှုကလူနာဆန်းစစ်ခြင်းလုပ်ငန်းစဉ်ဒါမှမဟုတ် CCAS လို့ခေါ်တဲ့အရာကစစ်တပ်သားတွေကထိခိုက်ဒဏ်ရာရလူနာတွေကိုဆန်းစစ်ခဲ့ပြမှာအသုံးပြုလုပ်ငန်းစဉ်တစ်ခုဖြစ်ပါတယ်
So we start with them carrying the fire. They go out there, get fire superiority, make sure there's no obvious bleeding on the arms or the legs. If there is, they put a tourniquet on and they drag them what we call off the X. They drag them off the X and into tactical field care. Let's go, get off the X.
ဆန်းစစ်တဲ့အခါမှာတော့တင်နန်းသားတွေကို march လို့ခေါ်တဲ့စကားလုံးတိုင်းလိုက်နာကိုသင်ကြားထားပါတယ်အဲ့ဒါကတော့ပြင်းထန်စွာသွေးထွက်ခြင်းလေပြွန်းအသက်ရှူခြင်းသွေးလည်ပတ်မှုနဲ့ခန္ဓာကိုယ်ပူချိန်ကြာဆင်းခြင်းတို့ဖြစ်ပါတယ်
Start with your blood sweep. If I see blood, I'll pack it. They start with a blood sweep from the neck all the way down to make sure they control the bleeding.
Hey, can you hear me?
And they go to airway, making sure that their airway is open. And then they go down to respiration, so they open up all their gear, look at the chest wall, and make sure there's no holes there.
For holes all the way down.
Look at the back, make sure there's no injuries over there. They move on to circulation, make sure that they have a pulse, what we call radial pulse, down there in their wrist. And they go down to hypothermia, so we're always making sure that we keep our casualties warm, so we wrap them up in a blanket. And then we move into tactical evacuation care. At this time, the medic should be at the head of the litter. The security should be at the foot. And you're getting ready to take your casualty to the HLZ. Then they're just reassessing at that point, making sure that all the interventions that they have done are still working. They'll start giving pain medications if they need it, antibiotics if the casualty needs it, while we're waiting for the bird or the vehicle to come get the casualty out of there.
Actually seeing somebody getting hurt in combat is extremely stressful. But if you have that muscle memory, because you've done this skill over and over and over again, it's like tying your shoes. You don't have to think about tying your shoes, you just do it.
I need y'all to get CCP set up now.
In the perimeter. Come on, Louis.
Yes,
I'm pretty sure they're tired, they're stressed out, they want to fight each other, they want to be in the comfort of their own homes. But again, it's training, retrain to fight, and this is what we do.
Once the students stabilize their patients, they evacuate them to safety and to receive further treatment. When casualties are evacuated from combat, they're taken to a battalion aid station the second portion of the field training exercise.
Sir, can we get pulse and SpO2, please?
So they're expected to triage casualties, get them into the aid station, get them treated by doing their combat casualty assessment and treating any life-threatening injuries, and get them stabilized to move to the next highest level of care.
They can't feel your radio pulse. We can't feel his radio pulse because so we're gonna have to do IO.
We throw all kinds of different patients. We start out with sick call patients, patients with normal everyday illnesses or injuries. We see trauma patients from amputations to gunshot wounds to abdominal evisceration.
It's gonna be what, 1 milligram. So we're gonna give her 100 off the bat.
They are pretty physically tested. They just get bombarded with patients sometimes, and it's exhausting. And then after a few days, or even after the 12 hours that they're on shift or 16 hours that they're on shift, they just get tired.
All right, he's got abdominal evisceration and left leg amputation.
We're working on 4 to 5 hours of sleep a night, if that, because in a realistic world, medics will not have that much sleep because we're going to have patients nonstop.
The patients students treat in this portion of the field exercise are represented by these high-fidelity mannequins that trainees first encountered earlier in their training.
Do I have pressure yet?
Nope. Yeah, for a millisecond.
We teach them how to be able to pack junctional bleeds, how to put on tourniquets. But with these mannequins here, they're able to see, okay, here's how tight I need to have a tourniquet, how much pressure I need to hold into packing a junctional wound.
Once it's pretty much packed, that's when you pile the rest in, and your body weight, for the medics, your body weight is what's gonna help you. You do not, if you're just over here like this, it's gonna keep bleeding.
The mannequins the students work with are able to move, breathe, and bleed, and even offer real-time feedback.
So that controller shows all the vitals of the casualties. Once they start packing a wound, it shows if they're holding enough pressure to be able to stop that bleed. If they're putting on a tourniquet, it shows if they're having enough pressure on that tourniquet to be able to stop that bleed.
Bleeding control. Extremities.
Once we were able to give them that real-time feedback, they know, all right, that's how much pressure I need to apply every time. This is exactly what I need to do to actually save a life on combat environment.
Working with these mannequins is very interesting. They act very much like a real person, so it can be a little bit intimidating when you first come up to one, because it is our first time really working with something like this, as opposed to just having, somebody else just laying on the ground and you're just sort of going through the motions. It makes it a lot more real.
Get his armor off.
Training gets even more realistic when students are put through a simulated combat scenario in which they have to find and treat their assigned casualty within a certain amount of time. Doing so in near total darkness and surrounded by the sounds of battle.
It's important for the soldier medics to be put under these stressors because they're not always going to be put in ideal situations when having to apply these interventions.
It was a pretty stressful environment coming in. There was a lot of flashing lights and it was pretty dark and very loud. Simulated very much a real combat environment.
Put his arm up and over. Arm up and over. Arm up and over.
When trainees approach a mannequin, they perform a casualty assessment, following the march procedure they learned earlier in training, and work to stop any bleeding as quickly as possible.
Hurry up, move quickly.
All while instructors monitor from eyes in the sky.
In my control room, I'm able to see what everybody's doing. If you were to look around, you see that I have 16 cameras throughout my lab, so I can actually direct them right on to where my casualties are, so I can actually get a better view.
The mannequins also send real-time vital signs information to instructors so they can monitor the students' performance.
I'll be able to see their heart rate, blood pressure, respiratory rate, their end-tidal CO2s. It'll show me that they're still bleeding. It'll show me whether the bleeding is controlled and the time that it was controlled. This one here, they've been maintaining pressure, so they've almost got the bleeding controlled because they've been holding it for 3 minutes. This one's close, but that one didn't make it. He died on it. He bled out.
How long was he bleeding from femoral artery?
About 2 minutes.
No, like 7 minutes. Till almost the end of your assessment. Your patient died. And then he stopped bleeding.
I take notes as I'm doing it, so that way when I do a debriefing, I can actually come out and tell them, like, hey, your patient died at this time. This is what they died from.
The mistakes students make at this point will act as valuable lessons as they move on through their training.